Hi, welcome to our very first IFSP meeting. I'm so honored to be working with you and your daughter, Dolly and May. This meeting is very introductory, and just like I briefed you in the email, I invited an early intervention specialist, Dr. Seuss. Please feel free to ask me or her any and all questions. No questions are silly, and we are really here to support you in any way that we can. Dr. Seuss, do you have anything to add?
Hey, I'm just really looking forward to working with you and your family. I will work with you mainly to assist Dolly Ann May in her physical, social, and emotional development. As much as I am here for her, I want you two to know that I'm also here for you. In this meeting, we will discuss all of the options regarding an introduction to early intervention, potential modes of communication, and school placement.
It's very nice to meet you all, and I really appreciate the support. Having a support system makes me feel so relieved. I do have a few questions, and I'm sure that my wife does as well.
Yes, it is so nice to finally get to chat with you guys regarding our baby girl.
I was wondering if you could tell us a little bit more about your family history.
Neither my wife or I have any prior history with golden heart syndrome or deafness that we are aware of that would have caused this. We were informed that it could be due to a use of certain drugs, but my wife certainly did not partake in any of those.
Well, golden heart syndrome actually doesn't have any known cause, and from what we do understand, it's not a genetic condition. Research has determined that there are some variables that could potentially cause it. So, for example, if the mother could have diabetes or if she had rubella or influenza while she was pregnant.
I do have diabetes, and I was diagnosed with it a good while before I had Dolly and May. I just hope that we can give her the best possible access to all the resources that she needs.
Yes, well, of course, that is why we are all meeting, all in the best interest of Dolly Ann May.
I noticed in her paperwork here that she has an absent auditory nerve bilaterally and that the left cerebellum is atrophied. She is most likely experiencing some profound to severe hearing loss, and I see that you did have a hearing screening when she was born. And have you gone to see an audiologist? They would be able to provide you so much more information and specifics about how to address her hearing loss further.
Yes, we were actually recommended to an audiologist, Dr. Gray, but haven't set up an appointment yet. Do you have any idea of a time frame of when we should go see her?
Yes, we suggest the child be screened by 1 month, diagnosed by 3 months, and by 6 months they are being introduced to early intervention specialist. As an early intervention specialist, it is my job to support your family in all the decisions that you have made and will make in the future in the best interest of the child. It is so important that we get those meetings set up to get her on the right track for success.
That is so helpful. Thank you. We were thinking about how we can help her learn and develop typically. We just didn't know where to start. I didn't even know that there were specialists that could support us through that.
Yes, since Dolly is now 6 months, we've realized the importance of typical milestones, especially noticing her when she plays with others at daycare. School's been really difficult for her since most of her peers are hearing. We have always valued education. My wife and I both received college degrees, and we just want Dolly and May to succeed.
School placement is a very difficult decision and not a decision that any parent takes lightly. There is no right or wrong way to make the decision. It is just solely depending on what is going to meet the needs of your family as well as the needs of Dolly. The first decision that needs to be made is the modes of communication you would like to pursue.
I think that our final decision for her mode of communication is ASL. We have started teaching her and are trying to get her a deaf babysitter as well. We think ASL will give our daughter full access to communication, that way she is not excluded. We have received a variety of different opinions on the different school placements. My wife and I were really excited to talk to you two about it on a more professional level. We of course want our daughter to excel in academics, but are more worried about how she will adapt socially to her environment, especially based on which mode of communication she is using. What do you both think would be the best fit for her socially as well as academically?
Well, this decision is totally up to you. There are pros and cons of each. A deaf school would meet the needs of her if you pursue American Sign Language, as she would have teachers, peers, and administrators that will share the same language and culture as her. The cons of deaf school is the location, and most deaf schools are residential schools. Therefore, Dolly would be gone during the week. As far as mainstreaming her in a public school, she would have an interpreter with her most of the day to assist her in interpreting and understanding the teacher, students, and the environment of the classroom.
We've also been considering getting her an auditory brainstem implant after some advice that we received from the doctors that she's seen, who told us that a cochlear implant wouldn't work for her because she has no auditory nerve bilaterally. What do you know about them, and what would your recommendation be when it comes to that? We've also started using ASL with Dolly and May, and we're wondering what else that we can do to give her the best ability to communicate.
Luckily for my wife and I, we took ASL classes in college and are continuing to go to ASL classes every week. We were just not sure if there's anything else we can do.
There are definitely multiple options that are available to you, and if you're wanting to go down the listening and speaking route, then an auditory brainstem implant or ABI might be the route for you. There is a good amount of rehabilitation that is involved if she gets an ABI, but a lot of people have had very positive results from it. It is also so great that you're using ASL with her, and I advise you to continue using ASL even if you do decide to get the ABI. That will give her the best access to total communication.
Our main concern about the ABI is that we do not want our daughter to feel as if she is not part of either the hearing or deaf community. I think this is definitely something we'll have to have further thoughts about, but all this information was extremely helpful and relieving to my wife and I. Thank you guys so much for your time, and I'm looking forward to our next meeting.
Yeah, and we can totally provide pamphlets on everything that we've discussed today, and I'm so looking forward to our next meeting too, where we will go into some further steps with an early intervention specialist and hopefully get you started with her ASAP. Please feel free to email me or Dr. Seuss with any questions or concerns you may have. I hope you have a wonderful rest of your afternoon. Bye now.